As I grew up, my parents were medical workers. I got the passion to do what they were doing. I'm a veterinary officer, an extension worker. We look at zoonotic diseases. These are diseases shared between animals and humans. Once the environment is not conserved, it will translate into health effects occurring in communities. So we know that anthrax is a zoonotic disease that affects both animals and human beings. That's why working with human side of health is so important. So I use a motorcycle. One, they're swift, they're easy to get, and they help reach to farmer in the villages. Farming is becoming harder and harder for our livestock farmers because of frequent floodings, and this is affecting the soils or the environment. It is making these animals graze almost to the soils, and this is increasing incidences of disease outbreaks, especially anthrax as one of the priority zoonotic diseases in Uganda.
Kale bwe nasanganga egudde nendayo nengamba omuzeeyi wange. Omuzeeyi nangamba tokwatako. Omusawo Susan yangambya bwegwa temusikwatako. Ebenjeda mu mabeere. Ni Mosi nga yasalire Mosi nafunako school fees weba baana.
Derek has supported the lab through many avenues.
My name is Derek Emmanuel Mimbe. I work at Perth as a project director for the Infectious Disease Detection and Surveillance Project. We've seen an increase in zoonotic diseases due to flooding. When climatic change affects the communities tend to venture into the forested areas, and that increases the human contact with the animals, and that exposes them to viruses in the animal habitat. It's quite a big challenge. Lydia and her teams support the different sectors in the district, that includes the sub-counties, and I find that the work they are doing is quite demanding. However, they continue to support the community as best as they can. I think it's an amazing piece of work. Perth has supported the National One Health platform, working with the different ministries and health sectors to come up with national standard guidelines for the priority zoonotic diseases.
So what we've done to prevent outbreaks of anthrax, we've done sensitization of farmers about different disease conditions, specifically anthrax. We've done a vaccination of animals. Of course, vaccination is one of the preventive measures. And then disease surveillance, routine tests and routine monitoring of disease conditions which are within maybe the locality or within the district. Many families out there depend on these animals as a source of living, as a source of food. all these living organisms, all these infectious organisms come from the environment. So I'm hopeful that if environment is handled well, we shall have healthy human beings and healthy animals.